Dr. Latza here and Dr. Mazgalov. We're continuing our series on low back pain, and today we're going to talk about kinesio taping, which is a really important step in transitioning you from a more acute phase to kind of incorporating more functional aspects of it, as well as strengthening the low back. So tape is really helpful for a couple of things. It increases blood flow to the area, which is going to help flush out inflammation and bring fresh blood and fresh nutrients so that the fibers can heal. It also increases nervous system input to the area so that your body can kind of focus on it and be ready for those muscles to fire. So we want, for this taping, we're going to do just a simple low back pain taping. Requires 3 strips of tape, and you want to measure them out. You're going to have 1 strip on either side of the spine running lengthwise, as well as 1 strip that kind of goes across the low back. Now, a lot of people don't know this, but after you cut the tape, you want to round the edges. So fold the tape in half like this, take your scissors, and you're going to round the edges here. Rounding the edges ensures that the tape is A, more comfortable, and B, kind of stays on better because there's no sharp corners to get caught on things. Then you're going to do, you have your 3 strips here. You're going to do the one on either side of the spine and the one across like we were saying. So I'm going to have Dr. Maz bend forward a little bit. You always want to stretch the tape, stretch the body, and not the tape. So you have her kind of bend forward a little bit. We start with our shorter strip. Now a lot of people, they spend time trying to peel the backing off the tape. The easiest way to do this, and we'll kind of zoom in, is actually just rip the paper on the back rather than spending time trying to peel it. So create a little bit of an opening on the tape, create just a little bit of stretch in the tape, and place it right over the low back, making sure that it's really stuck and kind of peeling it off on either side here. Then we do the same thing for the long strips. Again, peel it, create yourself a little bit of an anchor. Start on either side of the sacrum, right above these kind of little dimples, right over these little dimples here. Then you kind of lengthen it over the muscles on either side of the spine. You can pull the paper backing up, and then it just goes along the spine there. Do the same thing on the other side. Create your anchor right over the SI joint. Run it up along the spine. Again, you're not really stretching the tape that much. You're kind of just laying it down. And it is okay, you can see here I cut this strip a little bit longer than this one, and that is totally fine. And when she sits up, you can see how the tape is kind of puckering here. That's actually the effect that you want. That's what creates the lift between the skin and the underlying tissues, allowing increased blood flow to that area. So, something that we're gonna be incorporating in the office, as well as something we'll show you how to do at home. Perfect.